Hi, everyone. So I'm Allison. I am one of the child life specialists at Kennedy. And I just want to thank you guys for having me today. This is a really cool opportunity for me. So I don't know if you guys have worked with child life before, but you can go to the next slide. Child life specialists are basically just trained professionals who help kids from ages 0 to, we actually help kids past 21 because at Kennedy we have a lot of uh, patients who are developmentally delayed. So I've helped patients as old as like 45 before. But our job is just to help patients and families cope with the stress and uncertainty that comes with anything medical that's going on. Our background is in developmental and psychosocial impacts of illness. And so we do a lot of different things in the hospital environment that are individualized to the needs of children and their families. And I'm going to talk a little bit more about um, what we do and how we do this. A lot of people don't know that we are a non-billable service, so we are completely free to all families, which is really great because we don't have to, we're very accessible. And I think that's something that's really unique about our job. So I work in our outpatient building at Kennedy Krieger. We have a bunch of different clinics, and the Batten Clinic is relatively newer for our team. We just started providing support um, consistently in the past like 2 or 3 months. And so I'm really excited to see how we can expand the services that we provide to these families. So what is the scope of a child life specialist? We do a lot of diagnosis education, procedural preparation and support. We do a lot of sibling support, emotional support, and then we do medical play and then normalization play as well. Um, and I'm going to go a little bit deeper into each of these in the next slide. So, what does diagnosis education look like from our standpoint? Obviously, providers and nurses give their own education, but our role is really to use age-appropriate language and taking into consideration each child's learning needs. And at the bottom, you'll see I put we give out a lot of books to families. Unfortunately, because that Batten diagnosis is so unique, there aren't really a lot of books or many books at all that are specifically targeted to Batten. But these kids also have a lot of other things going on, and so providing books are just a really great way for kids to feel like they can understand what's going on. Obviously, all kids read at school, and so sitting down face to face with the child is a little hard, but using books can really help them to relate. And so some of the books that we have, we purchase and we give out to families for them to keep. We're very grateful that we have the funding to be able to do that. Um, and then this other page is something that one of my coworkers created. We create a lot of our own books, which is really fun, and it's personalized to each kid. And so we've created social stories, if anyone's heard of those, and it can be about anything. It can be about their diagnosis. It can be about going to the doctor. It can be about their journey if they're starting a treatment of some sort, which is really nice that we can individualize it. And so, yeah, we make these for a lot of different families. And we usually will ask, like, what is your child like? Just to make it a little more fun and personalized to them. Next slide. Procedural prep and support is probably one of the biggest things we do in our building. So we introduce coping techniques and we provide procedural support for patients. We will prep kids before the procedure. So if a child's having a blood draw, we will bring in the medical supplies with us, minus the needle, of course, and we will review the steps of the procedure. Sometimes we'll give a teddy bear a blood draw to help them understand and increase their sense of control. And then during the procedure, we provide support and distraction with whatever the child may like. Maybe they like light up toys. Maybe they want to watch their favorite movie. Um, Different hospitals will have different um, tools, but distraction is really great, obviously, to turn their attention away. Sometimes kids like watching, sometimes they don't. And then lastly, we suggest a lot of comfort positions. So sometimes kids need help holding still, but we can talk about different ways to make it a little more comfortable for them. Back to chest comfort hold, where kid sits in the parent's lap, and they put their arms around them with one arm out for a blood draw, for example. So um, these are just some of the things that we do to make procedures a little bit easier for our kiddos. Next slide. Sibling support is a big one, especially in Batten Clinic. So we meet with siblings to assess coping and provide a therapeutic space for them. Sometimes siblings feel forgotten, not on purpose, just because the patient is obviously getting the most attention. In their medical appointments. And so we want to make sure that we check on the siblings and see how they're coping with all of this change. We provide information and we create resources, both for the sibling and for caregivers. We want to empower caregivers to feel comfortable talking to their children. And so we'll give certain language to them to help answer certain questions that kids may have. And then also along with that, informing caregivers about typical responses that siblings may have when a child is diagnosed, when a child is, say, losing their vision or something that's a really big change in their family. And then we can provide strategies to help with siblings cope with that. And recently at Kennedy, we have started a SIB Shops, but SIB Shops is not just a Kennedy thing. It's a nationally recognized program for siblings. We cover siblings ages 7 to 14, but it's for complex and chronically ill children, and it's for the siblings of those children. So it's just a space for kids to come, and we do different activities. We open up the floor for any type of conversation that the kids want to have. It's not a support group. It's more just like a therapeutic space for kids to come. And so I highly encourage everyone to see if their area has SIB shops because it is amazing. I have seen kids come and be like, your sibling has a chronic illness too. And it's really, really sweet to see them connect. So highly recommend that. Next slide. This is just really important, I think, for everyone to know that works in the medical field. Kids, this is an article, and I'm happy to send it to everyone if they are interested, but there was a quote that said, pediatric medical traumatic stress is a set of psychological and physiological responses of children to potentially traumatic events such as pain, injury, serious illness, medical procedures, and invasive or frightening treatment experiences. And basically, this is just a reminder to everyone that we don't know what these kids are coming into this appointment with. Kids' reactions to procedures and medical environments are typically from something that happened beforehand or that was really scary for them. We have a kid that we're working with now who's deathly afraid of triage, blood pressure, temperature. And after talking with dad, we learned that he had a really, really traumatic experience getting triaged at a different hospital. And so now we're trying to work on building his trust. And so we just want to be mindful that these kids are coming in with a story that maybe we may not know. And that's always a good reminder for everybody, even myself. And this traumatic stress can persist for months after an acute injury or hospital stay. And so I did want to end my talk with what can we all do to help make the patient experience as positive as possible. And so involving the patient in care, this is what they talk about in the article, and then I'm going to talk about a few things. Providing choices, control, or distraction, managing pain as well as possible, and then having caregivers present as much as possible as well. Next slide. So what are some considerations for pediatric patients when we work with them? Some of this might seem super obvious to you guys. Some of it is a good reminder. I know sometimes I'm busy going into a room and I have forgotten to introduce myself. And so I just wanted to, if your hospital doesn't have child life, or even if they do, these are all really good things to be mindful of. So always introducing yourself and your role. These patients are meeting a ton of different people. Sitting or kneeling at eye level when speaking with patient. A lot of our patients can come in wheelchairs or they're sitting in a chair and standing over them is really intimidating. And so I always kneel either next to the patient or I sit if there's a chair to make it a little more like a conversation. Don't lean on or move a patient's wheelchair without permission, always asking. Encouraging participation rather than doing tasks for them. This is something I am guilty of wanting to be a helper, but we should also be empowering patients to, they can do a lot of things on their own and they want to. And so that's really a good reminder. Offering choices when appropriate. This is a really, really big one. I see all the time. For example, if a patient has to take medicine, not saying, are you ready to take your medicine? When it's not a choice, but rather saying, it is time to take your medicine. Do you want to take it in a syringe or a cup? Because what we do when we say, are you ready to take your medicine? Kids are going to say no, and then they have to take it anyway. So you're losing that trust. So giving choices is a really big one. Being mindful of how many people are present in the room. I know a lot of times I'm in rooms with providers, nurses, students, and it's really, really overwhelming when you're the patient. So sometimes asking when you have a big group is just a good first step. And then either dividing up and conquering and having people come in at separate times or just being mindful of that is a good first step. And then if able, before starting the physical exam, explaining what you're going to do to the child just so that they know what to expect. And you'll find that even these little considerations are really great for the patient, and also the parents will be really appreciative as well. Next slide. And I just wanted to include these like language do's and don'ts. Again, I am guilty of these sometimes, but so say if a kid is in a blood draw and someone says, you don't need to cry, saying something like, it's okay to feel scared. Let's talk about a plan to make you feel less nervous. A lot of times I've found in our culture, we are very quick to say like, this isn't scary. You don't need to cry. But we want to be validating of children's emotions. And this is causing kids to think that their emotions aren't valid, and that they shouldn't feel this way. And so we should really be validating, like, this is really hard. Like, let's talk about it. Another one, I actually already said this, but a different example is sometimes we have a playroom here at Kennedy, and I always hear parents come in and say, are you ready to go when it's clearly time to go? And the kid's like, no, I want to stay forever. And the parent's like, okay, we got to leave. And then they have a complete meltdown. But instead offering them a choice, like, do you want to spend your last 2 minutes over here or over here in this area? Um, and then avoid making threats. Sometimes I hear this. Sometimes I hear things like, if you don't behave, the doctor will give you a shot. That's really scary for kids. And I know sometimes we don't really know what the correct thing to say is if a child is refusing to do something. But threats are something we really want to try to avoid. Next slide. So you guys might be thinking, like, how do we engage our child life team? So here at Kennedy, we do have a clinic cell that one of us carries at all times. We have a shared email that goes to all of us. There are 3 of us that cover the outpatient building. And then we are also on Epic, so we can be Epic messaged at any time. For those of you that are not at Kennedy, reaching out to your hospital's child life department to see if they cover your area. I feel like outpatient is a little more unique to have child life coverage in. Child life is oftentimes in pre-op or inpatient. So if there's not a child life specialist that specifically covers the Batten Clinic, I know a lot of kids come to the hospital to have infusions or procedures. And so try to see if those areas have child life. And that can be like you're into having child life support. But yeah, I speak for Kennedy, but we are always wanting to help. We want to see more patients. And so I'm sure if you guys reached out to your child life department in your hospital, they would be more than happy to help or realize that there's a need that's not being filled. So that's basically everything. Do you guys have any questions? Eric?
Thank you so much, Allison. Really appreciate your comments and for helping us to think more actively about child life. Some of us, I think, work very closely and very often with child life, but we may not necessarily do that in a research context. So I'm wondering if you might be able to provide some suggestions on engaging in the research context and the kinds of questions or ways we might open that discussion. And then also to everyone, if you are already working with your child life specialists for research, can you talk to us a little bit about the kinds of things and the ways that you approach those teams?
Yeah, I can, if it's helpful, I can speak to like other research that we've helped with, and see how that relates to this. Oftentimes for research patients, we are meeting them like when they have procedures. A lot of research patients have a lot of procedures, obviously. And so, um, honestly, the biggest thing for everyone to know is just like sitting down for 5 minutes before you start something and just getting to know the patient and family. I feel like that can go a really long way, and you're going to learn a lot from that. So that would be my like word of advice to everyone, to just like take a minute to like sit. I know there's usually a lot of like paperwork that you have to fill out, but sitting and just like acknowledging that they are, a patient is here for something that's usually pretty scary. I think sometimes we all get caught up in like our day to day. I am guilty of this. And we kind of get like numb to some of the patients that we see. But if you were in their position, you would want someone to sit down and be like, how are you today? How are we feeling? What can I tell you about the day? That goes a really, really long way with a family. So that would be my like number one word of advice for anyone in like the research context. Um, yeah, I don't know if that's like kind of what you meant, Erica, or if you want me to speak to something different.
Do you have suggestions for how research teams might invite child life, if they're not already working with them, to collaborate or to think about how they might partner during research visits? Any suggestions for that as well?
Yeah, I don't know. Obviously, I don't know how to like, you'd have to, all hospitals with child life typically have a website. So you would know a little bit more about them. So I would reach out and basically just like, my advice would be to explain what types of things that you are doing with patients. So is it a lot of procedures? There's always something that child life specialists can help with. So if they say, if you're always going to have something that we can help with. So whether that be, obviously any kid that comes for a research study is going to have a diagnosis of some sort. So there's always that diagnosis education that could be done. Um, may or may not be sibling support. Research usually involves a ton of visits. So it really could be helpful to tell the child life specialist that we could benefit from some sibling support. Um, so I think diagnosis education, sibling support, and procedural support are going to be like um, your biggest way to get child life to come help. Um, and kind of describing the patient population and what a typical research day may look like. And then that can help the child life team to kind of figure out like how would we fit in here.
Thank you. That's really helpful. And I'm wondering if there's anyone, oh, actually, Heather.
Oh, hi, this was a wonderful presentation. I'm at the University of Rochester Batten Center. I just wanted to mention, it's not a question, but just an FYI, since you had noted there really aren't books for kids with Batten disease. That's true, but there is a really great book that was written for siblings called Max and Abby. And it was actually written by Innika Whiteman, who's with BDSRA for the US and Australia. And I know that BDSRA makes that book available. So you could reach out to that organization for copies of it. It's a really nice book for siblings to explain that disease and what's happening to their sib.
Oh, that's so cool. Thank you for that. Yeah,
You bet.
we have a lot of different diagnosis books, so we're always looking for more. And like I said, we're newer to the Batten Clinic, so I'm excited to look at that. And if everyone's interested, I can also send some like generic books that we use, like some generic sibling support books, some emotional expression books. I can send them to Erica if that's helpful. I don't know the best way to get them out to all of you guys, but sometimes we'll print like a book list and give it to families if your hospital doesn't have the funding to provide these. But we do have a list of books that can be used for any diagnosis that are really helpful. And we have found parents are really appreciative, even for a list. So I'm happy to send that.
Thank you, Allison. If you share those with us, we can make sure that they go in our next newsletter. And Jennifer Vermillion is on the call. We can also ask to have those distributed to all of the centers of excellence so that people have the Batten specific and the more general links available. Are there other questions? And I also want to invite anybody who regularly is working with child life for research to share any experiences or suggestions that they might have. And if no one is yet working with child life for research, then we have opportunities to sort of grow that experience. Ray.
Yeah, I can't emphasize how important child life is. I'm in Orange County, and we had our child life specialists, help our kids and our families when they started their Brineura infusions. Every family would, and Suzette can speak to this, but the specialists would get to know every child, every family, and identify sort of what calmed them the most, what was their favorite movie, so on and so forth, to help the whole medical process go more smoothly. But I think equally important for research as well, because with that comes procedures, and if the cognitive understanding, or even if the cognitive understanding is fully there, it always helps to have a specialist sort of be alongside the family and explain things, and the child, and explain things in an age-appropriate developmental fashion. So can't emphasize how valuable and thankful I am.
I second that, Dr. Wong. We've had our child life specialist at Chalk for, I want to say 6 years, right? 6 or 7. We had a couple first off that were a little shorter tenure with us, but she's like family, and I know I've shared my thoughts on that already. But it really can make the difference for just a much smoother and much calmer, and yeah, sometimes less traumatic, sometimes visit for sure. And she's helped us tremendously.
Yeah, I feel like I don't know if this is just a Kennedy thing, but there shouldn't be any convincing that you have to do to get a child life specialist to come see a patient. We always want to come help. There's always something we can do. Even if you don't think there's something, I feel like child life specialists always find something to ask, or we spur conversation in a way that maybe other people don't. And so, yeah, I would just, again, encourage, I even created for a different research study, a prep book that they now are sending out to all the participants, so that they know what the research study is going to look like. And even that could be a good way to be like, hey, come into my clinic. Can you help us make this prep book? And then the research person will be like, yeah, these kids get infusions. And they're like, oh, I can help with that. So that might be a good way to reel them in. But as far as us, you say, oh, can you come see this patient? We're like, yes. So hopefully there's not a lot of convincing that needs done. Someone else have their hand up? Oh, hi.
Yes, hi, Alison. Thank you so much. That's it's so great to, I guess, give some time from the clinician side to understand what child life is and how we can encourage our clinicians to engage. I'm from the BDCRC Foundation, by the way. I don't think we've met before. But I want to flip that around the other way as well and see how well are our families familiar with child life as a concept, and are they informed about this service that is available, and how can we sort of spread the word? I think putting resources on our website, the BDCRC Foundation's website, is a great start, but also just to confirm the importance of child life in a good integrated multidisciplinary management approach, we do have a supportive therapies panel that will be presented at the family conference next month, and we do have a child life specialist that's going to be presenting from Children's National. So from that perspective, we're really excited to I guess expose families to this concept, and that this is a free resource, a non-billable resource that's available. But any other suggestions on how we can promote this as a service to families so they know to proactively ask for it?
One quick question before I speak to that. I think you guys said that every hospital engaged in this has child life, correct? Is that true?
In the centers of excellence? Not
Yeah.
necessarily.
Oh.
Yeah, I'd be interested actually just for those that are on the call to either raise their hand or pop in the chat whether they do have a child life specialist that they have. I know Chuck definitely. Yeah. Nationwide. Yeah. So most of us do.
Mhm. Yeah, a lot of people are
Yeah.
probably going to say that like they have child life, but like do they cover Batten Clinic?
Mm.
And it's tricky because I feel like I have reached out to other hospitals before to provide handoff. Like if a patient is leaving Kennedy and going somewhere else, being like, hey, do you cover this area? And they're like, no. And that's kind of it. I think Kennedy's a little rare. We're always like, yeah, we'll go here, we'll go here. I feel like I guess my concern is saying that child life is available to all these patients and then it's actually not. So I think I would encourage the people that have child life at their hospitals to reach out and see if it's something that could be possible. And then I feel like anytime there's maybe a new eval, I don't know if there's paperwork that's given out, but a little spiel somewhere on the paperwork could be really helpful. I know myself, I am trying to check in on every patient when they come for Batten Clinic to just introduce services, even if there's nothing happening that day, or in the immediate future, just so that they know we're here. But I realize that that's not possible probably for every child life specialist to say that they're going to go into every room. But if the providers can speak to it, would be really, really helpful. Again, not every family is going to need child life at every appointment. And so I would encourage every hospital to kind of figure out like what capacity do you have your child life specialist available? And maybe figuring out how to include that in maybe the new evals. I love the idea of including it in more like broad messaging, but I also worried like, oh, I have a child life specialist. Wait, I actually don't. So that's what's making this question a little bit tricky is knowing is a child life specialist actually going to be available for support even if it exists at the hospital, if that makes sense.
Yeah, no, that's really helpful. And perhaps we'll be mindful in how we frame that to families too. So, before you, you know, go too far down the track, make sure you're aware, make sure you've inquired as to whether that's a service available in your particular centre.
Yeah.
And then Erica's had a great suggestion as well for those sites that are presenting a poster at family conference to include that as an element in your multidisciplinary approach. If that's part of your team, then yeah, be sure to highlight that too.
Yeah, something too that we're doing that I don't know if it would be possible or we're trying to do is get our name in like the after visit summary of the appointments.
Yep.
That way, when families get that, they'll at least see like, oh, child life specialist. And even if they didn't meet them, maybe it could have a little like blurb of what child life does. We also have like, there's so many things hospitals can do. We have consults in Epic or whatever, like EMR system you guys have. That's another way that we've tried to make it a little more accessible. That's more for providers and nurses. It's hard though. We really, really struggle sometimes to spread the word of child life. It's something that's really hard in our field because people don't know we exist. And it is extremely, extremely frustrating sometimes because I'm like, we're here, we want to help. And so that's a struggle that I have is like helping people to understand that we exist. But yeah, the AVS and then maybe whatever you guys give out in like new evals would be really helpful. And then I do love that she's presenting at conference. I actually was emailing back and forth with Sophia, getting some insight from her. So
amazing.